Hi, my name is Bjorn Westgard. I am staff and faculty at Regions Emergency Residency. Hold on, let's go back. Is it possible? Okay. In St. Paul, Minnesota, with Dr. Zwank. So I'm going to talk about narrative medicine, the stories we tell, and how we can achieve better care and experience through narrative medicine. So something completely different. Storytelling is our age-old tool for learning and sharing about each other, our world and our place in it, for understanding the things that happen to us in life. The best stories have good listeners and tellers, compelling characters, and an arc. They can acquire mythic power and shape how we see and behave in the world. Our modern stories, they may involve more elements, more chaotic, more disrupted lives, and they can seem complex, especially when they come into the emergency department, but they're still stories. Stories are foundational to medical practice, and that we focus on the histories that we take. In our haste, sometimes we forget about the stories that we can make along with our patients. After history and exam, we diagnose and we treat based on evidence for a general disease and a general population. But if we listen a little longer, we hear the person around the disease. History taking treats the path to the ED as factual and responsive to questioning, but the facts can get complicated by their context, and we have to listen for both. To do this, we need active listening skills, listening to both biology and sociology, filling in the blanks to make the strange narratives of our stories, of the stories that our patients tell. These stories are often a jumble of symptoms and people that we have to disentangle and place them into an arc that makes meaning of the illness and its ties to how this person is living. When we retell these stories to our patients, we make sense of illness in the midst of life, and we create space for shared experience and decision-making. Actively listening without judgment and then naming and retelling our patients' stories are also those acts that have been identified as essential to conveying empathy. So we need the story of what happened prior to the ED, but also the story of the workup and the treatment that we're engaging in. And then we have the story of where and how patients will go when we're done, past, present, future. We should tell a story about the differential, the diagnostics and interventions we envision to convey uncertainty and to manage expectations. And then we should also talk about the pathophysiology we encounter to share the catharsis of diagnosis. And we should lay out the disposition that's ahead, the treatments and the care plans we've suggested, the appointments, the referrals, the horizon of recovery, however cloudy, and how long it's going to take to get there. By tying the story of illness and an ED visit back to the biography of a patient, we mend the broken path. We stabilize the story, charting the course to a new equilibrium. And when we do this well, it's like reading a crystal ball. We're deciphering the past and we're naming the present, and we're foretelling possible futures, however uncertain. And this promotes resilience through some knowledge, some connection, some shared experience. But how can we do this when we feel inundated by volume and acuity and complexity that drive distraction and delay and limit our time for listening and crafting shared narratives? It's true, time constrains our capacity for conversation and connection, but we've got more time than most. And narrative skills can enable us to maximize meaning making in the time that we do have. And we already do this, even in our most critical and time-sensitive cases like trauma. You've been in a bad accident. We're doing a lot of things right now to help you. We're going to take good care of you, past, present, future. By getting better at telling stories, we can move beyond being EMR-bound diagnosticians and proceduralists, beyond automation and pushing buttons. Through narrative, we can improve our empathy, professionalism, trustworthiness, and reconnect with the art of medicine. And like any art, it takes practice, but that's what physicians do.
Thank you for that. Judges?
Great job. I think telling stories and talking with our patients is such an important part of our job, and you did a good job summarizing, a great way to handle that.